Hi everybody, today I'm going to discuss an extremely important topic, especially it is related to female, and that is amenorrhea, which means absence of menstrual periods. And this is a very important topic. You should listen to it and watch this video very carefully from the beginning till end, because I'm going to highlight the most important causes and I'll discuss about risk factors and management of amenorrhea. Okay. So let's start the video. Amenorrhea is the absence of menstruation, one or more missed menstrual periods. Okay, women who have missed at least 3 menstrual periods in a row have amenorrhea, as do girls who have not begun menstruation by age 15. The most common cause of amenorrhea is pregnancy. Other causes of amenorrhea include problems with the reproductive organs or with the glands that help regulate hormone levels. Treatment of underlying condition often resolves amenorrhea. Now let me tell you the symptoms. The main signs of amenorrhea is the absence of menstrual period. Depending on the cause of amenorrhea, you might experience other signs or symptoms along with the absence of periods, such as milky nipple discharge, hair loss, headache, vision changes, excessive facial hair, pelvic pain, and acne. You should consult your doctor if you have missed at least 3 menstrual periods in a row, or if you have never had a menstrual period and you are age 15 or older. Now let me tell you the causes of amenorrhea. Amenorrhea can occur for a variety of reasons. Some are normal during the course of a woman's life, while others may be a side effect of medication or a sign of medical problems. First, I'll tell you about the natural amenorrhea. During the normal course of your life, you may experience amenorrhea for natural reasons such as pregnancy, breastfeeding, and menopause. Now coming to the other reason, one most important reason is contraceptives. Some women who take birth control pills may not have periods. Even after stopping oral contraceptives, it may take some time before regular ovulation and menstruation return. Contraceptives that are injected or implanted also may cause amenorrhea, as can some types of intrauterine devices. Coming to the medications. Which medications can cause amenorrhea? Certain medications can cause menstrual periods to stop, including some types of antipsychotics, cancer chemotherapy, antidepressants, blood pressure drugs, allergy medications. There are some lifestyle factors which can also cause amenorrhea, which I should tell you now. These lifestyle factors contribute to amenorrhea. For instance, low body weight. Excessively low body weight, about 10% under normal weight, interrupts many hormonal functions in your body, potentially halting ovulation. Women who have an eating disorder such as anorexia or bulimia often stop having periods because of these abnormal hormonal changes. Well, I'm on my channel. Since I am a general physician, so I'll post all kinds of videos, including this gynecological topic videos. So please keep on watching my channel, and these are what I have told you about the disease like anorexia or bulimia. I'll make videos on these illnesses inshallah in future. Okay. Another factor, lifestyle factor, is excessive exercise. Women who participate in activities that require rigorous training such as ballet may find their menstrual cycle interrupted. Several factors combine to contribute to the loss of periods in athletes, including low body weight, stress, and high energy expenditure. Stress. Well, this is a very important cause of amenorrhea. Mental stress can temporarily alter the function of your hypothalamus, which is an area of your brain that controls the hormones that regulate your menstrual cycle. Ovulation and menstruation may stop as a result. Regular menstrual periods usually resume after your stress level decreases. Now, another common reason is hormonal imbalance. Many types of medical problems can cause hormonal imbalance, including polycystic ovary syndrome. This polycystic ovary syndrome, also known as PCOS in short, it causes relatively high and sustained levels of hormones rather than the fluctuating levels seen in normal menstrual cycle. Thyroid malfunction. An overactive thyroid gland hypothyroidism or underactive thyroid gland hypothyroidism can cause menstrual irregularities, including amenorrhea. Well, on my channel Hubayt Bibi, I have uploaded videos about hypothyroidism, and hypothyroidism as well. So you can watch those videos, okay, that are really very helpful. Another reason is pituitary tumor. A non-cancerous, which is a benign tumor in your pituitary gland, can interfere with the hormonal regulation of menstruation. Premature menopause. Menopause usually begins around age 50, but for some women, the ovarian supply of eggs diminishes before age 40 and menstruation stops. So these were the hormonal imbalance causing amenorrhea. Now I'll tell you about structural problem that can also cause amenorrhea. Problem with the sexual organs themselves also can cause amenorrhea. Examples include uterine scarring, in which a condition known as Asherman syndrome, which is a condition in which scar tissue builds up in the lining of the uterus, can sometimes occur after a dilatation and curettage, that is D&C. Caesarean section or treatment of uterine fibroids. Uterine scarring prevents the normal build-up and shedding of the uterine lining, so that can cause amenorrhea. Then another reason is lack of reproductive organs. Sometimes problems arise during fetal development that lead to a girl being born without some major part of her reproductive system, such as her uterus, cervix, or vagina. Because her reproductive system did not develop normally, she cannot have menstrual cycles. Another problem is structural abnormality of the vagina. An obstruction of the vagina may prevent visible menstrual bleeding. This is a condition known as imperforate hymen. Okay. A membrane or wall may be present in the vagina that blocks the outflow of blood from the uterus and cervix. I mean, in this condition, the blood is coming from the uterus, but there is a imperforation due to imperforate hymen, so you can't see blood coming out. Okay, so this can be a cause of amenorrhea. Okay. Now coming to the risk factors that may increase your risk of amenorrhea may include family history. If other women in your family have experienced amenorrhea, you may have inherited a predisposition for the problem. Eating disorders is another risk factor. If you have an eating disorder such as anorexia or bulimia, which I mentioned already, you are at higher risk of developing amenorrhea. Athletic training. Rigorous athletic training can increase your risk of amenorrhea. So these are the risk factors for amenorrhea. Now I'll tell you the complications of amenorrhea. These include infertility. If you do not ovulate and have menstrual periods, you cannot become pregnant. The second complication is osteoporosis. If your amenorrhea is caused by low estrogen level, you may also be at risk of osteoporosis, which is a weakening of your bones. So these were the causes, risk factor, and complications of amenorrhea. Now I'll tell you about the diagnosis. During your appointment, your doctor will perform a pelvic exam to check for any problem with your reproductive organs. If you have never had a period, your doctor may examine your breast and genitals to see if you are experiencing the normal changes of puberty. Amenorrhea can be a sign of a complex set of hormonal problems. Finding the underlying cause can take time and may require more than one kind of testing. So these were the main things about history and general physical examination, which is very, very important. Now coming to some lab tests. A variety of blood tests may be necessary to find out the cause of amenorrhea. First and foremost, and it's very important, is pregnancy test. This will probably be the first test your doctor suggests to rule out or confirm a possible pregnancy. The second is thyroid function test. Measuring the amount of thyroid stimulating hormone, that is TSH, in your blood can determine if your thyroid is working properly. And another test we can order is ovary function test. Measuring the amount of follicle stimulating hormone, that is FSH, in your blood can determine if your ovaries are working normally. Prolactin test. Low levels of the hormone prolactin may be a sign of pituitary gland tumor. Male hormone test. If you are experiencing increased facial hair and a lowered voice, your doctor may want to check the level of male hormone in your blood. Another test is hormone challenge test. For this test, you take a hormonal medication for 7 to 10 days to trigger menstrual bleeding. Results from this test can tell your doctor whether your periods have stopped due to a lack of estrogen. Then we may order some imaging test. Depending upon your signs and symptoms and the result of any blood test you have had, your doctor might recommend one or more imaging tests, which include ultrasound. This test uses sound waves to produce images of the internal organs. If you have never had a period, your doctor may suggest an ultrasound test to check for any abnormalities in your reproductive organs. Computerized tomography, that is CT scan. The CT scan combines many X-ray images taken from different directions to create cross-sectional views of the internal structures. A CT scan can indicate whether your uterus, ovaries, and kidneys look normal. And then we may also order MRI, that is a magnetic resonance imaging. This uses a radio wave with a strong magnetic field to produce exceptionally detailed images of the soft tissues within the body. Your doctor may order an MRI to check for a pituitary tumor. Then we may order some scope test. If other testing reveals no specific cause, your doctor may recommend a stereoscopy, which is a test in which a thin, lighted camera is passed through your vagina and serves to look at the inside of your uterus. So these were the tests of amenorrhea. Now coming to the treatment. Treatment depends on the underlying cause of your amenorrhea. In some cases, contraceptive pills or other hormone therapies can restart your menstrual cycles. Amenorrhea caused by thyroid or pituitary disorder may be treated with medication. If a tumor or structural blockage is causing the problem, surgery may be necessary. So these were the treatment which depend upon the cause. Inshallah, in coming up days, I'll make separate videos on the causes of amenorrhea, and please keep in touch with my channel. Okay, keep watching my videos. Now I'll tell you some lifestyle and home remedies. Some lifestyle factors such as too much exercise or too little food, as I told you previously, can cause amenorrhea. So strive for balance in work, recreation, and rest. Assess areas of stress and conflicts in your life. If you cannot decrease stress on your own, ask for help from family, friends, or your doctor. Be aware of changes in your menstrual cycle and check with your doctor if you have concerns. Keep a record of when your periods occur. Note the date your period starts, how long it lasts, and any troublesome symptoms you experience. So this was my video about amenorrhea. This is a very long topic, but I have tried my best to tell you the important causes, okay, and risk factor and treatment. Okay, till now, if you haven't subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think my video provides some sort of benefit, even it is a little bit benefit, please give a thumbs up to this video. And because this liking of the video will give me encouragement to make more useful health related videos on my channel, and that will help you to identify various health related issues. Okay, and please do not forget to share my videos, because this channel of mine is basically meant to help humanity across the world. So by sharing videos, you will be also part of this great initiative. Thank you very much for watching this video. See you in next video. Bye.